I'm Peg Doyle, host of our series Medfield Wellness, Connecting Mind, Body, and Community, and I'm pleased to have Kathy McDonald, Director of Medfield Human Services, here with me today to talk about the many services that Medfield Outreach offers to our community. Welcome, Kathy.
Thanks for having me.
Happy to have you here and really pleased. Can you tell us about your role within the town of Medfield, Kathy?
Sure, I'm happy to. I'm the Director of Medfield Outreach, and I'm also the Director of Human Services here in Medfield. And what that includes is overseeing the human service departments. And in the town of Medfield, that includes Medfield Outreach, Council on Aging, Veteran Services, and our public health nurse. And while each of those departments are unique and provide a variety of services, there is an overarching commonality that we share, which is that we provide services to residents in Medfield, human services. So by working together as a department, we're able to increase our knowledge, our really depth of knowledge around what services the other sister human service departments offer, as well as understanding where there might be room for overlap, where we might reduce replication of services and really increase and enhance working collaboratively to expand services. And let me give you an example of one way in which we have done that successfully. So Council on Aging runs a fabulous program, lots of great services for our seniors in Medfield, but they don't provide clinical services. So staff from Medfield Outreach, who are licensed clinicians, have been able to go into the Council on Aging, offer bereavement group, clinical consultations, counseling when necessary, thus expanding the services that the Council on Aging is able to offer while partnering with another human service department.
Well, that's really a very creative and effective way to make use of the resources, isn't it?
I am thrilled and very fortunate to work with the other directors of the human service departments. They're fabulous, they're dedicated to their craft. We also work closely with Medfield Park and Rec and the library, because as you can imagine, they too provide human services, provide services to the end user. Although I don't oversee those departments, they do join our monthly meetings and we do have a great collaboration.
Wonderful. That is terrific. So would you please describe the work that Medfield Outreach performs specifically?
Sure. So Medfield Outreach provides a whole array of social services. I would say in order to sort of simplify it, there are four major components of what Medfield Outreach does, and then depending how much you want to go into each of those four components, I'm happy to elaborate. But the first being the provision of clinical services. Second, needs-based or community assistance programming. Third, our prevention programming. And lastly, and most recently, overseeing the opioid abatement funds and opioid abatement work that the town is doing. I can tell you a little bit more about each of those if you'd like.
Love to hear
Okay.
it. Yes.
So clinical services are really mental health services. And that can be from maybe a one-time point of contact to an ongoing services. So we very often will receive emails or calls from community members that might have a concern about a variety of mental health topics, maybe their child, maybe a divorce, maybe a whole array of things that people go through all the time. And they might call us, obviously confidentially. Their information is confidential. They're working with licensed clinicians. And we can offer a consultation, a clinical consultation, either on the phone or in person. From that clinical consultation, we can determine what are best next steps, a referral out, to provide services within Medfield Outreach, etc. And then we do our best to work with the community member to find out what do they need, what are they feeling comfortable with, and how do we best hook them up with those services. Our needs-based programming or community assistance programming, we are thrilled and able to make all of these programs that I'm going to tell you about that I get really excited about because of the rich partnerships with other organizations, coalitions, businesses, individuals in the town of Medfield. We have the most generous partners in Medfield, and with these partnerships we have been able to develop programs that include campership funds, backpack distributions, coat distributions, overseeing funds raised by the Medfield Foundation to help people alleviate emergency costs.
So it sounds like in town, Kathy, you are identifying people with financial needs. We think of Medfield as such an affluent community, but we do have some financial needs here in the town as well.
Definitely. And a lot of times those financial needs can't be met by other outside support. And Medfield is unique in that we have what's called the Community Assistance Fund, again in partnership with the Medfield Foundation, to help applicants who qualify for the services have support in a variety of ways. And if anybody wants to learn more about that or anything that I'm talking about today, they could go onto the town website, find Medfield Outreach, and then click on any one of the tabs, needs-based programming, clinical resources, etc., and they can learn a lot more about the services we offer. Of course, they're always welcome to call us as well.
So before we get to prevention, I just wanted to ask you too, initially Medfield Outreach was called Medfield Youth Outreach. So as you're describing the services that are available today, it's a much broader organization now.
Yes, and I think that that might have been true historically as well. Medfield Youth Outreach adopted the name in 1979 when the program started. And while it's historically true that our clinical services have been mostly focused for youth and families, that wasn't true for the other work that I had described. That was really all community-based to anybody, no matter what their age, as long as they were a Medfield resident. So when I came aboard in 2020 and learned more about the services that we were offering, I felt like it was a little bit of a misnomer to be called Medfield Youth Outreach. It might actually be a deterrent to other citizens of Medfield to think that these services weren't open to them, weren't available to them. So with the support of our advisory board and certainly the support of the select board, we proposed a name change just to drop the youth and to become known as Medfield Outreach. And we rebranded and we really tried to get the word out that if you are a Medfield resident, you are eligible for our services. We're here to help you, we're here to serve you, and we'll do our best to do so. And I would say that that rebranding, as you would imagine, has taken time, but our clientele has definitely changed and increased to be a lot more than simply youth and families. Although I will say it had been originally, but is even more so today.
And as you said at the beginning, you have such an array of department agencies that are affiliated with quite a large organization in that there are subgroups with the directors of each, but you all work together. So that's a really centralized, wonderful way of providing services. So I can't wait to hear more. And you were going to speak about prevention.
Sure. We oversee two community-based coalitions. One is called Medfield Cares About Prevention, known as MCAP, and the other is the Medfield Coalition for Suicide Prevention. And both of those community-based coalitions do a whole lot of work, which I think we might talk about in more detail today. The last thing and the most recent thing that Medfield Outreach is doing is overseeing the work with the opioid abatement funds. And
can you talk about that, the opioid abatement funds?
Sure. So the opioid abatement work is happening. It started, I want to say, in 2021. Governor Healy signed on to the opioid abatement class settlement, and through the abatement funds, municipalities are receiving a portion of those settlement funds. I believe Medfield started to receive funds in 2022, and each of these settlements have different sort of trajectories, if you will. So every year for the next several years, we will have payout from these settlements. And it's important to say that there are also other settlements that are pending, more lawsuits around the opioid abatement work. Opioid crisis, I should say. So what we have done in alignment with the Massachusetts State Sub-Agreement is to really do best practice before we spend any of the funds. And the way that best practice was aligned to us and trained to us in a technical advising that happened was to do a survey of your community, to interview and listen to key stakeholders in your community, and to provide what's called listening sessions. So I'll talk a little bit about each of those three steps that we have conducted and completed here in Medfield. First, we did a community-wide survey. We partnered with the SAFE Coalition, who has been helping communities do this work and has a survey that looks at each of the 7 abatement strategies to ask the community how important each of these 7 abatement strategies are to them, thus tailoring the work that we do to each community in the way that the community feels like this work should be conducted. So we did a community-wide survey. We had what's called a stakeholders meeting, and the key stakeholders in our community would include people that you would expect: the superintendent of schools, chief of police, chief of fire, board of health chair, prevention work, mental health, our town administrator, and as well as our consultant that we're using to help us guide this in this work. And that discussion really looked at and listened to, in each of those domains, how has the opioid crisis impacted those domains in a way that can be reported back to us so that we could be better informed, again, how to utilize these funds to best help our community. The third, and probably the most important step, was to listen directly to those people in our community who have been directly impacted by the opioid epidemic. Maybe they've lost a loved one, maybe they're caring for a child due to the illness or ongoing SUD, substance use disorder, OUD, opioid use disorder, or alcohol issue that a loved one might have. So we wanted to hear directly from those people. How has this crisis impacted you, and how do you feel these funds should be utilized? So all of that data is contained on our website. Again, you can click the link. You can see all the survey results. You can read about the stakeholder meeting. Everything's up there if you want to lean more into that work and really get a grasp for it. But the outcome was that our community overwhelmingly thought there were 3 areas that they wanted addressed: expanding access to mental health services, continued work on prevention, keeping Medfield healthy. You know, we are lucky. We have a pretty darn healthy community, and folks want to see it stay that way and continue to improve on the health and wellness in Medfield. And then the third was to increase access to harm reduction, specifically Narcan trainings and access to Narcan. And I'm thrilled to say that we've listened to that feedback. We've hired an opioid prevention coordinator to expand mental health services, to connect people to resources and care. We have contracted with SAFE, to the SAFE Coalition out of Franklin, to provide 3 Narcan trainings this year. We'll do our first one this fall. We are having like drop-in coffee hour to hear more from people that maybe haven't had a chance to participate or weren't ready to participate, to connect and come together to indicate or find ways to support each other in how this epidemic has impacted them. So all those things will be happening this fall. And as I had already mentioned or will mention, the prevention work that we're doing just lends itself beautifully to this expansion of services with the opioid abatement work.
Mm-hmm. Were you at all surprised, Kathy, by the outcome of your survey, your interviews with stakeholders, or your meetings with people affected by the opioids about the extent of a problem it might be in Medfield currently or in the past?
I think what surprised me was, you know, we have the data from emergency services and police, and that data, as you'd expect, looks pretty good in Medfield. So, but what we did see is that there are family members or loved ones that live in Medfield who have lost people to deaths due to the opioid epidemic, or due to substance use disorder, or an addiction issue, or maybe loved ones who are now caring for children. So those numbers were higher than we knew. I think it's probably no surprise to anybody that we've also, post-COVID, and even probably pre-COVID, have been hit with a mental health epidemic.
Sure.
And those things go hand in hand, right? When people are struggling, they turn to things to help them cope. And so part of our goal is to increase prevention and access to mental health services so that we can hook people up with care and support and keep them healthy and as well as we can.
Wonderful.
Yeah.
Talk to me, Kathy, about the 2 prevention coalitions we have in Medfield.
Sure. So I'll start with Medfield Cares About Prevention, and we call it MCAP. And MCAP is a coalition comprised of a variety of sectors. So by that I mean business, schools, law enforcement, mental health providers, parents, students, and the goal of that coalition is to reduce youth substance use in Medfield. Specifically, we target alcohol, marijuana, and nicotine. This work is done really enhanced with a Drug-Free Communities grant that we applied for and received in 2019. And the Drug-Free Community Grant is a 5-year, $125,000 per year grant from the federal government to assist doing this work. That grant allowed us to hire a full-time prevention coordinator whose job is really to oversee the coalition, to do this work, to focus on the data that we collect in partnership with the schools, looking at both the great data about the things that promote health and wellness and healthy decision making, and then to look at the areas where we might be, our youth might be at risk, and how to shore up those areas. So we did that for 5 years, and then we went through a competitive bid cycle, very competitive, I might add, and I'm thrilled to announce that we were awarded years 6 through 10. So we are in current, yeah, I know, we're thrilled. So we're currently in year 6 of that work, and we will have 4 more years. I believe it will conclude in 2029. And again, at the same funding, $125,000 per year. So one of the staff people that work for me out of Medfield Outreach is funded completely through that grant. And then other funds from that grant we use to enhance safety in town. What do I mean by that? Well, bringing in speakers that might come speak to the youth, bringing in safe transportation, so allowing transportation costs to either be deferred or completely paid for to and from the prom, right? So end of the school year, prom season, that tends to be the most dangerous time for our youth. Sure. So anything we can do to help keep them safe, that grant is there for. So we work very closely with the schools. We work very closely with our sector reps, again, doing that work over the different sectors and different domains in our community, so that work is wide-reaching and can have the most impact.
Wonderful. And so much of the work that's done with youth will reverberate throughout their lives, so to start there is really a great place, but not to forget that as they grow older, they also possibly will need support. So I love that you shifted from only youth to a full community outreach. That's really important and a good milestone for everybody.
Thank you. I'm thrilled to say that this past year, one of the students brought the idea to us of starting a youth leadership program. And so now we're having more and more youth spearhead this work, and so they can reach their own peers. I mean, that's the goal of this, right, is for the youth to make this resonate with their peers and be able to be their voices. And so we're seeing that shift start to happen, instead of being so led by adults, really sort of teaching and encouraging the youth about the strategic prevention framework. It's based in science, and the evidence-based practices that we have been trained to use, passing that on to them, and then allowing them to work in the schools and in the community with their peers, and that will reverberate.
Yes, for sure.
Yeah. And
your other coalition?
Sure. So the other coalition is the Medfield Coalition for Suicide Prevention, MCSP. MCSP was founded in 2017 and is comprised of community members and professionals who have the common goal of improving mental health and emotional wellness in the town of Medfield. We understand that our community has been touched by deaths by suicide, and so our mission is to reduce stigma, to increase awareness, and to provide resources and education to prevent suicide. We do that work predominantly during 2 months of the year. May is known as Mental Health May, and September is Suicide Prevention Awareness Month. And this is sort of all hands on deck, not only coalition members across the human service departments, businesses in town. Really, our goal is to invite people to think about the way in which they can participate in suicide prevention in a way that resonates with them. So for example, the library might feature books on wellness, or do a display on protagonists that might be struggling with mental health, and Whereas the Council on Aging might bring in a speaker or have us come in to talk about the importance of healthy sleep habits and how health contributes to good, how sleep, contributes to good mental health. Our veteran service agents, certainly veterans, are a group that's very impacted by deaths by suicide, has tried a variety of things. I think yoga was going on, warrior yoga, and we're working collaboratively across the departments to say, well, what would make sense for you, and what would you like to do, and what would you like to bring to this, and how can we support you to do it? We had a group of very dedicated coalition members kick off an inaugural walk this year on the rail trail, and it was called the Path for Hope,
yes,
with a beautiful turnout. I strongly suspect they're going to do that next year and the following year and the following
Sure.
year. So it's really a way for us to increase awareness, reduce stigma, get people talking about the fact that we have a lot of people who struggle with mental health, as we do in other communities and in the whole countrywide, right? I mean, it's a tough time for a lot of people. And if we can reduce the stigma and talk about it, we can instill hope, and we can connect people to resources and support them to the best of our abilities. And that's the goal.
Conversation is so important, isn't it? You were saying earlier how probably many, many people in Medfield have been impacted, if not directly, at least know someone who's been affected by the opioid epidemic. I would hazard a guess that the same is true with suicide, that most of us, unfortunately, know someone who's been impacted by suicide or has actually taken their life. And so to know that these resources are here is so important. And so a question I have for you, Kathy, is how do people reach you? How do people find you? Do they knock on the door? Where is the door? Do
the
they
door is a
call
little
on the
tricky to
phone?
find. Let me give you some easier ways. So we are a town department, but we're housed in actually the former Medfield TV space, which is in the Medfield High School, but sort of tucked around the back. An easier.
I can tell you I found you pretty easily.
Good.
You gave good directions.
Well, that's good. I'm happy to hear that. The best way to reach us is really to call. The phone number is 508-359-7121. So you're welcome to call. You are welcome to email us. And these numbers will be, of course, put at the end of this interview. But you can email medfieldoutreach@medfield.net. Those are the best ways, because then we can make sure that we understand what you're looking for, and we make an appointment for you with the best fit of our staff to connect with you. In addition, we always have a presence at Medfield Day. We have a double booth. We will have sign-up sheets for people who might be interested in participating in either of those coalitions. We have our business cards and takeaways, resources that we give out, pens with our phone number and contact information on it. But we really want to get the message out that we are here for Medfield residents. We are here to help you, and if we can't, it is very likely that we can find some other agency or service that can be of help. And that is what we do very well. We're connections to care. Support, connect, care. That's the work that we do at Medfield Outreach.
So at Medfield Day, which is coming up before we know it, or may already have occurred before this goes on air, when you say somebody may want to join the coalition, are you looking for volunteers?
We're always looking for volunteers. People reach out. We're so lucky that there's a lot of great folks who say, I want to get involved. You do great work. How can we get more involved? Because a lot of what we do is confidential, we can't invite people to do our community-based programming or our clinical work, but a way that they absolutely can get involved is through any of our coalition-based work. The substance use prevention, the suicide prevention, even this new opioid abatement work, right? That is open, that's community-based work that's open to everybody. So we meet, those coalitions, those two coalitions meet one time monthly, which people could sign up to be involved in those meetings. And if they can't come, we offer those meetings in person and virtually to try to make it most accessible to everybody.
Great.
But if you can't make it, we can still email minutes out to you so that you understand what's happening. We we do different things that you can just get involved in a one-off, like the walk, for example. Maybe you want to participate and this feels like your wheelhouse. This is what you want to do. That's fine. You can just do as little or as much as you want. The same is true with our substance use prevention. We're always looking for people to get involved. You know, parents have the biggest influence over their children. The more parents get involved in our coalition, the better it's going to be.
To help
the
kids.
better it's going to be. Yep, 100% hands down. Parents are the most important people in their child's life. So we want them.
Yes.
Yeah.
Great. Thank you, Kathy, for your very informative presentation on the work of Medfield Outreach. I feel like I have a much better understanding of the important services you offer to our Medfield residents, and I believe our viewers will feel the same way. Is there any last message you would like to convey to our viewers?
Well, I would say, if in doubt, reach out. If you are struggling with something or you think you might need help, don't worry that you're making a commitment to an ongoing appointment, or just reach out. Just come in for a consultation or just call us. Maybe we can be helpful in a way that you haven't even thought that we can be helpful. And there's no obligation. Like we are really here. The Department of Medfield Outreach exists to support our community members through mental health, community assistance, prevention, opioid work. It's really a wide range of services, and we're here for you. So give us a call if you need help, or email us, reach out. We'd love to hear from you.
And I think what you said earlier about any phone call, any outreach is completely confidential. So people can rest assured that whatever their issue is, it will stay within the confines of the organization and the specialist who steps in to help.
Yes, it's especially true. So 2 of our 4 staff people, so one of the staff persons is a prevention coordinator through that grant that I mentioned, the Drug-Free Community Grant. Our opioid clinician is funded through our opioid funding, and then it's myself and a full-time clinician. So the clinicians are licensed, and we take an oath and an obligation through our clinical license to be HIPAA compliant, to have confidentiality, just like you would get if you went to an outpatient mental health center. Same thing.
One last question.
Sure.
We didn't talk about this in advance of our program today. Where does health insurance come in, or does it?
So that's one of the fabulous things about Medfield having this department. Not all towns have this department. Again, Medfield has a wealth of human service offerings. We do not take insurance. We are funded through taxpayer dollars. So if you are a Medfield resident, you're eligible for our services. Now, that doesn't mean we have the bandwidth to serve every single person with mental health. What we try to do is provide a stopgag. So if someone's looking for an outpatient provider and they need support, we try to provide short-term therapy until they can get hooked up with a more longer-term solution. And we do that regularly.
Really, really interesting. That's such a way to open the door for mental health services for people who are either embarrassed to use their own health insurance, or they don't have it, but they really need some support. So
yes, in addition, the fact that we're so accessible to the high school and the middle school, so if you have working parents that can't get their child to an outpatient appointment, maybe your schedule doesn't allow for it. Maybe you don't have enough vehicles for, whatever the barrier might be, it's an option to have them walk over and be supported through our services at Medfield Outreach. So those kinds of things happen regularly.
Wonderful.
Yeah.
Again, thank you, Kathy. This has been so informative, and I hope you and the Medfield community will take advantage of this very rich resource that we have right in maybe a difficult spot to find, but not really. If I found it, you can find it.
Thank you for having us, and most importantly, thank you for trying to get the word out of the services that we offer for the Medfield, to the Medfield community. I really appreciate you having me here today.
Wonderful. Thank you, Kathy.
You're welcome.
Thank you for joining us on episode 2 of our series Medfield Wellness, Connecting Mind, Body, and Community, featuring Kathy McDonald and Medfield Outreach. What a wonderful program to support all of our residents in time of need. Our third program features Council on Aging Director Sarah Hannafin and COA Chairman Robert Heald, who will tell us about the incredible array of programs and services offered to our seniors. You can catch all of our episodes right here on your local cable channel or stream them at your convenience on the Medfield YouTube TV channel. Please share the content with your Medfield friends and neighbors as we work to connect mind, body, and community for a healthier Medfield. And most of all, thank you to Medfield TV for the work of your talented staff in making this series possible.